be on this panel. As I thought about the comments that was asked to make, it was really about the notion of going forward to secure the Medicare for all so that we might live. Already my colleagues have covered some of the most essential efforts, so I want to highlight some things as you think forward about how we might go forward. One of the things I'd like to lay out is that I think we need to consider the notion that we don't any longer simply need identity politics or single issue politics, but rather we need to begin to direct ourselves towards building a comprehensive movement that proceeds from that old adage, an injury to one is an injury to all. Going forward, we get the opportunity to share that a single payer plan will assist us in leveling the playing field and bringing up the standards to pay doctors and care providers so that we might have more of them in our inner cities and in our rural areas so that we might live. Going forward, it will mean developing outreach that builds on multiple values, eliminating poverty, respecting the rights of women, including the rights of women who are oftentimes need the opportunity to simply make our own choices about our bodies. Going forward, we need to elevate our fight for health care for all as a part of crafting a new social contract that addresses economic sustainability and viability for our people and this earth. Because the old social contract, that tattered safety net, is in fact being destroyed step by step, state by state, by gutless politicians, Democrats and Republicans alike. And it is about time that we call the roll. We as working people who built this country stand up and demand, if they don't stand with us, get the hell out the way and we'll build new leaders. Going forward, we need to build a broad transformative movement that provides health care for all. This will include challenging the popular corporate-sponsored rhetoric that Latinos and undocumented workers specifically are the reasons for our health care debacle we have in America. Going forward, we have to take on the tough issues, like the primary causes for the lack of health care insurance today are the lack of jobs and the loss of jobs, and in fact the uncoupling of jobs with health care. It's not the undocumented workers or the uninsured who are causing the problem, but in fact this rotten, decaying capitalist system. We need to call it like it is. The reality is that what Congress is contemplating won't do one damn thing to help 14,000 brothers and sisters who are losing their health insurance every day. The reality is the struggle of the immigrant workers for human dignity, for the respect for health care, for just a decent living, which all of us need, is really the demand by corporate America that has made this mess that we are discussing tonight. But you know, I said to my colleagues earlier, I kind of liken it to the period of the Dred Scott decision. Maybe a person or so might remember that. And of course, at that dark time in American history, we there made a decision that, in fact, a whole part of the population did not have to be seen as equals. It put everything in jeopardy. Not only the poor souls who were in direct bondage, but organized labor, who was just beginning to awaken and understanding that if we were to have a future, we the people had to in fact step aside, had to say to corporate America, you be damned and get out the way. And at this point we're going to take on the slavocracy, but tomorrow it's called the insurance company and the pharmaceuticals so that we might live in America. Going forward, we need to elevate that immigrants' fight for dignity is our fight. You know, it's always been a love-hate relationship in America. First the Irish, the Germans, the Chinese, all of them who worked hard in this country, brought here under false pretenses, and then when their labor had been used, discarded and disrespected. But now we have a whole global picture where we're all being dissed. What the heck are we going to do going forward? Going forward. What Congress has really given us is a broad, big, new sandbox that the insurance companies can PPU on all of us, and we're supposed to accept that for the future going forward. I tell you, having an individual mandate and alongside of it, the ability to pay for hardships is nothing but a mess that allows us to say we're going to fight one poor person against the other. That's not the future for my grandchildren. I don't know about you, but I think that it is time that the old heads and the gray heads in here stop shaking behind your boots saying, well, we're going to take what NASA and these new people are willing to give us. In fact, we got to craft a new future. We can do this and get over the hype that if the corporations don't go for it, it ain't going to fly. They are running our country and, in fact, the globe to hell in a handbasket, and it will take we workers to redirect it. So that is the argument that the insurance companies will no longer be able to exclude, I beg to differ. Tell that to us when we're facing our hospitals closing, our clinics closing. Tell that to the men and women who are being dumped from your hospital clinics and back onto the streets, under the bridges, the shame of America. And these bills will do nothing to improve this criminalizing of the poor. In fact, the new poor, brothers and sisters who have lost their jobs, the new retirees, the new people who have been foreclosed on, we stand oftentimes fragmented and afraid, but we have a movement here for health care for all, that it is a human right. And we love hearing that, because poor people have been advancing this for decades. It is time that we bring our ranks together to advance a new vision and a new way forward. Going forward, we understand that Congress is in lockstep with a great number of these corporate powers. But we also have our intellect. We have our history. We have our history not just of resistance, but of building transformative movements. Notice I said transformative. I didn't say status quo movements, because some people are about that business and making a lot of money. But we also got some brothers and sisters in PNHP who have laid out some great 9 steps. Basic stuff. It could be done tomorrow. How could we change this? But we first got to wake our people up that if we want a different America, we the people will have to fight for it. Right. So going forward, I just want to make sure you know, we ain't the only ones that's on this road. We know that brothers and sisters in other countries, far poorer than we are, use the World Health Organization standard, and they do this little thing called, damn, everybody in their country has health care, and they don't have to pay for it. Imagine that. Rocket science. But it is a change, that revolution in values that Dr. King directed us to. So I submit to you today, and I think I'm on my time, and you can let me know. I submit to you today that let this be the call, the clarion call, that we're going to build up from the bottom. Not just that the injury to one is an injury to all, but the reclaiming of America that is just, that is fair, and that is available for all people. And I salute you and stand ready to work with you.